Well, 50 years ago today, surgeons at Hartford Hospital performed their first organ transplant. And since then, thousands of lives have been saved through organ transplants. Here to talk about this notable milestone, Dr. Glyn Morgan, Director of Liver Transplantation at Hartford Hospital. Thanks so much for being with us today.
Thanks very much for having me, Mackenzie.
So I guess let's get right to it. How many transplants have been done at Hartford Hospital since 1971?
Yeah, this is, it's a very exciting day for us here at the transplant program. This is a milestone that not a lot of transplant centers around the country have actually achieved. We've done just under 3,800 transplants here at Hartford Hospital. About 2,700 of those have been kidney transplants, just over 600 liver transplants, and just under 500 heart transplants. So it's quite a legacy.
And you kind of just touched on it a little bit there, but what types of transplants are done at Hartford Hospital?
Right. So we do adult kidney transplantation. We do pediatric kidney transplantation. We also do adult liver transplantation and adult heart transplantation.
And leading into this, what are some of the signs and symptoms that you might need a transplant?
Yeah, it's funny because a lot of, each organ system has a unique set of signs or symptoms that indicate that it's failing, and it can be very subtle. And it's kind of ironic that during the past year with the pandemic, I think we've all become a little more aware of our own health as well as the health around us. So I think people are a little better tuned to what's going on, but it depends on the organ system. So for example, in kidney failure, you may start to feel more fatigued. You may notice swelling. You may feel swollen in your legs. You may have a sensation of shortness of breath, and you may notice that your urine output has decreased. On the other hand, for liver transplant recipients or those who are in need of liver transplant, they may notice yellowing of the eyes or skin. They may also notice swelling in their abdomen with the fluid accumulation, but it can also present in more dramatic ways. Vomiting of blood can occur, or the onset of coma. So each organ system has its unique set of signs that you have to be aware of. So I think the important thing is just to make sure you're getting the care you need, especially in this time. Don't avoid your doctor's visits. Don't avoid the doctor's office, and pay attention to what your body is telling you. That is the most important thing. And listen to your family, because often we neglect ourselves, and it's our family that says, look, you better get to the doctor. I think something's wrong with you. So listen to those people around you.
Absolutely. And when we talk about organ transplants, so much of it has to do with organ donations. What should people know about that whole process?
Right. Transplantation is a team game. Nothing happens without the donation process. And of course, donation occurs in two ways. Deceased donors, those individuals who have passed away and who either made the decision during their lifetime that they wanted to do this, or their families were apprised of their decision to go ahead and be organ donors, or live donation, people that have chosen to donate to friends, to family members, or even just the altruistic donor, someone who's come forward who wants to do something incredibly generous and may not even know a particular recipient, but we can facilitate that as well. So without donation, nothing happens in organ transplantation, and we are, forever grateful to those individuals and their families to make that life-saving decision.
Absolutely. Dr. Glyn Morgan, thank you so much for joining us. And you maybe saw it there for those of you watching from home, but we did have that link for you for the call to action, hartfordhospital.org/transplant. There it is there on your screen. Thanks again for taking the time to talk with us.
Thank you very much.